The CDC recently published its first set of guidelines of what you should and shouldn't do after receiving the COVID-19 vaccine. So in today's To Your Wellbeing, our expert is going to explain how to apply those recommendations to our daily lives and prevent the spread of COVID-19. Family medicine physician Dr. Zoe Stallings with primary care at Pomona, that's a member of the Cone Health Medical Group. She is joining us as our expert today to kind of go over these guidelines. All right, so first and foremost, let's talk about this. What is considered fully vaccinated?
So fully vaccinated, if you have received the Moderna or the Pfizer, the second shot, 2 weeks after that second shot, because it's a two-part vaccine. So after the first and second in the series, we wait 2 weeks, and at that point, you're considered fully vaccinated. If you receive the Johnson & Johnson, it's a one-shot only vaccine. 2 weeks after receiving that dose, you are considered fully vaccinated.
Okay, so 2 weeks after the first one or 2 weeks after the just one and only shot?
Absolutely. No,
Okay.
2 weeks after the second, the last one of the series, means
Correct.
that you're fully vaccinated, yes.
Okay, so if you've reached the 15th day post-vaccine, right, what should gatherings with people outside of your household look like?
So if you are fully vaccinated, the CDC has now, reviewed the guidelines, and you can be around people who are also vaccinated in small gatherings. However, if you are fully vaccinated and there are people in the household, for instance, children under 16 or people who cannot receive the vaccine, those people should still wear a mask because the unvaccinated are still at quite a high risk. What we've seen with the vaccine is that most people who receive the vaccine have a very low risk of actually getting sick and even being asymptomatic carriers. So what we want patients to realize is that you can now start having small gatherings. So with a neighbor who's also vaccinated, if your grandmother who is 75 received the vaccine, she can now receive a visit from her daughter who also received the vaccine. So we are encouraging small gatherings of people who are also vaccinated.
But it gets a little tricky when there are people in the household that are not vaccinated.
Exactly, especially if it's multiple households. So the CDC actually recommends against multiple households mixing. The reason is that there's more likely that someone in that group would be positive and asymptomatic and could spread it very quickly to others. And of course, the rules are always different for those who are highest risk. And just to review, the highest risk are those who are immunocompromised. So if you're on a steroid or a long-acting medication prescribed, to suppress your immune system, if you're a diabetic, a pregnant patient, a cancer patient, if you're in that special category, if you're a dialysis patient, you have a different set of risks. So we don't want you to necessarily, take the mask off. We want you to keep the mask on, but you can still gather with people who are vaccinated if you are high risk and unvaccinated. If you are
Okay,
high
so
risk
then,
in general, we don't want you in closed space. We just want to keep some distance, but you can gather small groups.
all right, so let's go back to just our own household. Is a fully vaccinated person putting others at risk if he or she lives with someone who isn't vaccinated?
So the fully vaccinated in a household with someone who isn't, like a 14-year-old or someone who couldn't take the vaccine, they're
Mhm.
not necessarily putting them at risk. So the perspective is from the person who's unvaccinated. People who are fully vaccinated, the data now shows that there is very little risk of them developing moderate to severe disease. And now more data is coming out to say that they're actually quite protected. So the vaccinated person in the household is protected. The person who might be at risk would be the person who still moves around the world and is not vaccinated. So we do want you to get your vaccines. If you can, if you have a reason why you cannot get it, you stay in your mask, but please discuss it with your primary care. Read online at conehealth.com/vaccine. There are appointments coming up if you do want to get your vaccine, so you could be one of those vaccinated groups. Greensboro, Burlington, and Reedsville, Thursday, Friday, and Saturday. Please go online to conehealth.com/vaccine and look to see that you can make an appointment. Once the appointments fill up, you will then be on an email list so you can be alerted when more appointments are available. Because now that we're seeing that the vaccine is truly working and the risk of side effects are still very low, we just don't want you to miss out on the opportunity.
All right, and just in case you came in on the middle of that, there are appointments open Wednesday, Thursday, and Friday.
Yes. No,
Okay.
actually Thursday, Friday, and Saturday.
Okay.
Greensboro, I know, right? Thursday, Friday, Saturday, Greensboro, Reedsville, and Burlington.
Mm-hmm. Okay. All right. So we've talked about getting together with people maybe with masks on who have or have not been vaccinated. What about the do's and don'ts of meals with friends and extended family? Because that means your mask is definitely going to be off.
Absolutely. So for people who are vaccinated, they're at a lower risk of transmission and also becoming ill. So these are the people that it might be less risky for them to go out in public and consume foods at restaurants. You can gather also in the house. But let's say that your grandmother, she received her vaccine, but your grandfather didn't. We usually say to maintain some social distancing so that your grandfather might sit, 6 feet away, and that way, there's a less risk for him. We also think about when you are eating, maybe moving it outside if there are some people in the household who are not vaccinated. So if you want to get together with your neighbor and there are a couple of people in the household, the weather's nicer now, let's move that eating event outside so you can take your masks off. But if everyone is vaccinated, it is safer. Take your masks off, enjoy a meal. You still want to, do proper precautions if you're eating in public, washing your hands, making sure you're using sanitary utensils to eat. But when you're mixing the vaccinated with the unvaccinated, that's where you need a little bit more room. But the risk is still less that the person with the vaccine, like myself, I received my vaccine. I received the 2-shot series in January. So if I get together with my father who wasn't vaccinated, I am not at risk, even though I'm a healthcare worker, of making him ill. And since he didn't receive the vaccine, he might still maintain some distance, but there's still much less risk of transmission from me to him.
All right. What about if you're fully vaccinated and you're going to go out into public places, whether that's shopping or whatever it be? What are the do's and don'ts for that?
So we are still saying wear your mask. We're still saying wash your hands. We're still saying 6 feet social distancing when possible. We're also saying not to, you know, stand around in really tightly packed places when possible. So it doesn't mean that we take our masks off and throw caution to the wind. We are still saying when you're in public spaces, you still maintain those steps for public safety. There are different strains, there are different risks. We also don't know exactly if there might be a resurgence of high numbers again. So we still have to maintain those public health guidelines. So even though you got your vaccines and it's been 2 weeks or more, you still don't want to go to the grocery store. You still don't want to go to the mall without wearing your mask. So in public, keep that on. Bring hand sanitizer with you like we've always been saying. And wear a proper fitting mask. I can't say this enough. Covering the nose and the mouth is extremely important. It should fit properly and not leave space on the sides.
Okay, we're going to talk about some travel coming up in the next segment. Dr. Stallings is going to be with us until 6 o'clock. So, how do you get your question answered by Dr. Stallings? Well, you text us your question. That number is 336 379 5775, and we'll be right back.